This video is all about surgery and what it's really like to have surgery. I'm going to talk about big major surgery, not small stuff like resetting a broken nose or something. We talk about big surgery where you're under general anaesthetic and you're going to have some time in hospital afterwards. And I'll talk a bit about my experiences of surgery. I've had 4 surgeries, 2 were relatively minor, and the more recent 2 were very major surgeries. So I'll give a quick overview of the surgeries I had. 5 years ago, I had a colectomy with cytoreductive surgery. So colectomy means removing some of your large intestine, and cytoreductive surgery is when a surgeon looks through an area of your body and removes as much cancer as they can safely remove. I do have some film footage of it, so maybe I'll publish some of that later on. Yeah, in fact, yes, I will if I can find it. And that surgery was, I can never say this right, but laparoscopic surgery. So that means what we commonly call keyhole surgery. So keyhole surgery, the surgeon makes a few holes in you. So I had some holes in my abdomen, so kind of the area below your rib cage, I guess, talk about abdominal surgery. And I think there are basically 3 holes. So one for carbon dioxide gas to like inflate you, and one for the camera, and maybe 1 or 2 for the tools. And then a couple of years ago, I had another very major surgery, which was a liver resection. So that involved cutting away, I think, about half of my liver, and also the gallbladder. The gallbladder is an organ that sits underneath your liver and collects gall, I guess. Gall is, collects the bile, right? So the bile is used in the digestive process, so the bile collects in the gallbladder, and then from the gallbladder it goes into your small intestine, I think. Gallbladder is an organ that we don't actually need as humans, because our liver's so massive, it makes so much bile. We don't need a reservoir of bile. We've just got plenty of bile, and also I guess that we now eat food that's far more nutritionally dense than in the past. That's actually kind of it I find really interesting, and it's very easy to forget that modern food is, and in modern food like corn and rice and stuff, it's been changed by natural selection by humans over thousands and thousands of years, and it is so much more nutritionally dense than ancient food. So that was the liver surgery, open surgery. Now with liver, yes, sorry, I'm not really able to show you very well because I can't move my fixed camera around. But essentially, if you get your right hand and put it on the bottom of your right ribs, that's like the where your liver is. Your liver's like behind that. So liver surgery is almost always open surgery because you have to have a J incision. So the surgeon cuts from below your sternum, like below your breastbone, and then round to your right, and opens you up like a jacket. And to access the liver, which is tucked in behind the rib cage. The liver is I think the liver might be the second biggest organ in the body after the skin. So I think it's skin, liver, then brain. I probably should have checked that. But liver is massive organ. It has 500 known functions, and so it's like, I think, the only organ that regenerates. So you can cut bits away and it will grow back, although it does actually grow back a bit bigger because the major blood vessels can't regenerate. So I had keyhole surgery 5 years ago for removing some of my large intestine and cancer tumours in my abdomen, and then I had open surgery 2 years ago for a liver resection. I think it was something like 45% removal of my liver plus the gallbladder. I'll talk a bit more about my experiences later, but I wanted to talk more generally, because hopefully this is useful for you if you're going to have surgery, or if you know someone who's going to have surgery, and maybe a friend or family member, and you're going to be helping them out. So before your surgery, you need pre-surgical checks. So these are to see if the surgery can go ahead. And so both my surgeries, major surgeries in Japan, and I guess it's the same in other countries, but it's the anaesthetist who decides if the surgery can go ahead or not the surgeon. So surgery is performed by a surgical team, and big surgeries, you might have a relatively big team. In Japan, that's going to be a surgeon, maybe an assistant surgeon, anaesthetist, some surgical nurses, and maybe some kind of technicians. In other countries, you might have nurses who are more involved in the surgery, called sometimes called nurse practitioners, depending on the country. So, for example, some countries, the anaesthetist might be helped by a nurse anaesthetist. So you have these pre-surgery checks, and they're going to be like a blood test where they're going to test for lots of things that may affect whether you can have surgery or not. And they'll be particularly, at least for abdominal surgery, but I guess maybe all surgery is going to be particularly looking at liver function. One of the 500 jobs of or maybe several of the 500 jobs of your liver are detoxification. So your liver filters out toxins and breaks them down. Your liver is really, really key to living. So good liver function is very important. Platelet count. So do you have the enough platelets that help with healing? Coagulation test. Can your blood clot properly? A whole bunch of things. Inflammation, because for inflammation, so you measure that with CRP, which I think CRP stands for C-reactive protein, and I have no idea what the C stands for. But CRP, so the measure of inflammation, is very important, because inflammation can cause many surgeries to be dangerous, many complications after surgery. So blood test, chest X-ray. Big concern in surgery is your breathing. It's really important to breathe to stay alive. Your mouth is like going to be held open for hours during surgery. So the keyhole surgery I did was 6 hours, and I think the liver surgery was about that long as well. So you're going to have an airway rammed down there. So when I did my pre-surgery checks a month and a half ago for my upcoming surgery, at that hospital, which is a big teaching hospital, you actually see a dental nurse who kind of looks around, makes sure there's no loose teeth, no loose dental work, no loose like dentures, I guess, all the kind of stuff that could cause a problem with that airway rammed down your throat. And yeah, so chest x-ray is very important. They're going to be looking for like pneumonia and all that kind of stuff, and any issues there. And ECG, so that's your electrocardiograph, so the heart test. My check this time, I lay on a bed and they hooked me up to the machine with conductive pads and do a heart scan, cardiograph, so make a little graph of how your heartbeat is. For the previous abdominal surgery, the colectomy, they had like a little set of steps and you have to go up and down these steps and a certain number of times with this nurse. So in Japan, like the nurse is like chanting to make you go faster. In this case, the nurse was like chanting "Gambare, Gambare," which is like "do your best" or whatever. So you're kind of running up and down these steps. So they sort of measure heartbeat first, and then heartbeat after, and then a little bit later on to like see the recovery rate and stuff. Pre-surgery checks are obviously really, really, really important, and they have to be done quite a short time, or there has to be a window of time before the surgery where the pre-surgery checks are carried out. In my case, my surgery has just been postponed by a few weeks because I have another issue that needs to be dealt with. I need a root canal done in a front premolar, upper premolar, and that needs to be done before the surgery. So I'm going to have to do my pre-surgery checks again in a month's time. So you're going to get your chest x-ray, your ECG, your blood test, and maybe some other stuff as well. In my case, I had a CT scan and also an endoscopy. So that endoscopy is looking inside the body with a camera. And that's because I'm having a surgery on the intestines. So I needed to check there's nothing like stuck in there, or no like scarring that's kind of partially blocking anything like that. So you do pre-surgery checks. Now, in my case with these very major surgeries, there's a lot of meetings with surgeons and discussing stuff. And yeah, my pre-surgery checks that I had a month and a half ago, I met the anaesthetist. I had to watch a 30-minute video about surgery in the anesthesiology department, which was really quite traumatic because I've had 2 very big, nasty surgeries. So it brought back a lot of unpleasant memories. So yeah, that's kind of interesting. And yeah, just before watching that video on that same day, as part of the pre-surgical checks, I had colonoscopy. So I had 2 endoscopies actually, and so that again brings back lots of memories because you're in a room that's a bit, essentially like an operating theatre. Surgery is extremely high tech. An operating theatre is the most high tech place you've been in, unless you work like in a chip fabrication place or something. It's extremely high tech. I've had, when I had a proton beam therapy, I went to, although I wasn't having surgery, I went to like essentially an operating theatre where they do scanner guided surgery, So I had gold balls injected into my liver for the targeting of the proton beam, and so that was in a room where there's like all the surgical stuff, but scanner guided, so people would have surgery where the surgeon's looking at a CT scan and getting or an MRI or whatever, and getting a live scan. In this case, it's just a radiologist injecting glass balls into my liver, which was incredibly painful. Obviously, local anaesthetic, but still quite an amazing feeling. An extremely long syringe, and these are like 3mm balls. I mean, it's not like a speck of dust. It's like, while they were doing those, injecting those 3 gold balls, they were looking at a live ultrasound, so they're doing echo sounding of my liver. So it's an extremely high tech, and it's many aspects of it are quite traumatic. So I'm trying to remember what it's like to actually have the surgery. So you enter hospital, assuming you're not already in hospital. So for the surgery I'm next doing, I enter hospital a couple of days before. I think the surgery's on a Monday. I enter hospital on the Saturday morning, and first day will be coronavirus check, and for that, so it's you can't eat like 30 minutes before and that kind of thing. Can't drink for 10 minutes before, and it will just be this will be a antibody one from saliva, I think. So just going to spit test, and I'll be like taken to the hospital bed where I'm going to be. In Japan, you're on typically on wards of like 4 to 6 patients. I'm on a 4-patient ward, so you're separated from other people with like a flimsy curtain. In Japan, you have like a little locker next to your bed and a small fridge and that kind of thing. And some hospitals have TVs, some have coin-operated TVs, but obviously you can bring laptop, tablet, smartphone, that kind of stuff. And it's always important to check if the hospital has internet, because if not, then... So in my case, a friend has very kindly said she'll get mobile Wi-Fi for me, which would be very useful because this hospital I'm going to doesn't have internet in the wards. So that first night, in my case, would just be I'll eat a light meal, and then next day up early to start cleaning out my intestines, which is like you do for a colonoscopy. So that's generally going to be drinking 2 liters of just disgusting syrupy gloop. It is nasty. It's nasty, and it's time consuming. And if you drink it too fast, you vomit. So when I did it a month and a half ago, I think they said you should do 250 milliliters every 15 minutes. So you're doing a litre an hour. I'm sorry to my American viewers, I don't understand your system of measurement. But a large number of fluid ounces in total that you drink. 2 litres is a lot. It's so I do that to clean out my intestines, and when the medical staff are sufficiently satisfied that my intestines are cleaned, then obviously can't eat anything after that. And then the next day, up relatively early, usually a few hours before surgery, and then you are taken to the operating theatre. And it looks like, at least in Japan, looks like a kind of space shuttle deck. It's just full of high-tech instrumentation and pipes and all this kind of stuff. And then they do the anaesthetics, the anaesthesia stuff, and then you wake up. So you have no sense at all of time passing. It's not like waking up after sleeping or anything like that. It's just they do the anaesthetics and you wake up. So the anaesthesia, so I should say, they'll hook you up to a bunch of stuff. So they'll hook you up to a heart monitor. So that's interesting. So same as like the colonoscopy, you're on a heart monitor and you can hear your pulse, hear your heartbeat changing as it's more and more panicky. And you'll have an oxygen mask. You may be like lying on your back when they, depending on what the surgery is. So years and years ago when I had very minor surgery to reset a broken nose, it was like lying on my back, and the nurse anaesthetist came and injected an anaesthetic into my arm, which I think is like the sedative, so it's like muscle relaxant. I was very nervous at that time, so my blood pressure was kind of low, and I have narrow blood vessels anyway, so about 50% of people have quite narrow blood vessels, right? So it's really hard for the nurse to get the syringe in. So I had 18 attempts to get the syringe in correctly so they could put this liquid in. And eventually, the main anaesthetist or the surgeon had to come over and do it. So you might get a jab in your arm. When I had the liver surgery, I had an epidural, which is an injection into your back, into like the base of your spine, and so because of that, when I went into surgery, I wasn't lying down on my back, propped up with pillows, kind of looking at what was going on. I was lying on my side, and the anaesthetist was like ramming a big old needle in my spine. And because I'm not Japanese, as you may be able to tell, and I was having my surgery in Japan, the needle was actually too narrow. So they had to go and like hunt around in a cupboard and come out with like a wider bore needle. And I remember that was kind of painful, doing the epidural. It's nowhere near as painful as it should be, having something stuck in your spine. So they put like a local anaesthetic gel or something on your back first. So then the last thing I remember is the assistant surgeon. So in that case, there were two surgeons. There was the liver surgeon and the assistant surgeon. The person assisting with the surgery was actually a much more experienced senior surgeon. So the liver surgeon was doing the surgery because it was liver surgery and he's an expert of liver surgery. And he was assisted by the person who's actually in that hospital, became the head of the hospital. So the last thing I remember is like the assistant surgeon kind of grinning at me. He obviously enjoys surgery. My liver surgery was a very, very, very challenging surgery, and these two surgeons are exceptionally skilled for this kind of surgery. They're two of the top surgeons in Japan as a surgical team, and Japan has some of the best surgical outcomes in the world. So they are exceptionally good surgeons, and there's a very interesting look on his face. Like you could tell, or maybe I'm reading too much into it, but it was like he's seeing it. He knows it's going to be a very dangerous, challenging surgery, and he knew he'd be able to do it. I kind of felt I could see that in his eyes. And yeah, so I should say, so like the surgeons might have like stuff on that, like this surgeon, he kind of grinned at me and then folded down the optical devices for like zooming and stuff. You could even have surgeons sometimes wear special goggles if they've given you a dye that fluoresces under ultraviolet light to kind of light up bits where they're doing the surgery. For things like you can get surgical agents that will make cancer fluorescent under ultraviolet light. So that's kind of the last thing I remember, and then waking up. And so waking up after 6 hours of liver surgery. Oh, so I should just say, like, liver surgery is yes, it's very major surgery. That's no reason to be like concerned. Mine was of great concern and was exceptionally dangerous because my liver had 4 years of chemotherapy, and also I'd had radiation to the liver, so I had a proton beam therapy, and that makes the liver tissue you can get fibrosis, like kind of scarring, and when a surgeon cuts through that to get to whatever they want or need to get to, you might get like uncontrollable bleeding. So my liver surgery, I lost 500 milliliters of blood, and if I hadn't had so much chemotherapy and radiation, you might expect like 200 milliliters of blood loss, and in exceptional cases they might get that down to like 100 milliliters. So that's why the surgery was tough. So then you wake up. Now, I don't know about country to country, but at least in Japan, for kind of any big surgery, you wake up in intensive care, like the ICU, intensive care unit, not in a recovery room. So in Japan, I don't even think they have when you wake up from sedation in Japan, so like when you're sedated for colonoscopy or for wisdom teeth extraction or whatever, you wake up in a recovery room. But for the surgery, wake up in the intensive care unit. So there's a bunch of other patients there in various states of distress. And waking up after major surgery is extremely tough. After my liver surgery, so I remember waking up, and the first thing is vomiting into the oxygen mask. And so when you wake up after major surgery, I mean, the people are right there. I guess they've done something to bring you around. Maybe like in Victorian times, going to put smelling salts under your nose or something. But no, presumably like they give you a little injection of something or put something into your oxygen supply to wake you up. So I remember waking up, vomit into the oxygen mask, and then just a few things. So one thing is, of course, incredible pain. With liver surgery, they can't keep the epidural in very long. So my epidural maybe was even, I don't know if it would have been removed then. But yeah, the epidural has to be removed shortly after liver surgery, I think, for safety. In my upcoming surgery, I may not be able to have an epidural at all because my platelet count is low, and with low platelets, you can get like blood pooling in the base of your spine, and which is potentially fatal. So I might not get an epidural. So you wake up and you're in intensive care, and so with abdominal surgery, because they've cut through your stomach, like the stomach muscles to get in. So the abdominal muscles are like going into these spasms with a serious amount of force. And in the case of liver surgery, I just had open surgery. So you've got this huge J-shaped incision. So the Mac flips the camera because Apple is junk. My face isn't really this red. I do have a red face due to years of chemotherapy and also molecular targeted therapy, but it's not as bad as it looks. It's just this crummy Apple camera sensitivity peaks in the red part of the spectrum, so it makes me look much redder than I am. If I don't look red, then it's because I've done some post-processing in the iMovie, which I will try. So wake up, vomit, and incredible pain, and you've got these waves of pain going on. But the other thing is incredibly cold. Incredibly cold. I haven't actually asked anyone why that is, but shivering, and I remember my teeth chattering so much, and I was so frightened that I would smash all my teeth up. I think I do actually have a chipped tooth at the front, so maybe that was caused by the airway, or that's one of the things actually when you take surgery, they go through all the risks, and they always say like your teeth might get chipped or cracked and come out. So my teeth were chattering so much. Now, so I'm in an intensive care unit, and I speak hardly any Japanese, and I'm trying to explain that I'm frightened that my teeth are going to break, and in incredible pain. And rather hilariously, at this hospital, fantastic hospital, but they said if you need to call the nurse, you ring a bell, right? Now, they literally gave me two like metal chimes, like a little metal bell to ring. So I am ringing this every few seconds, and I am shouting out about the pain, like itai, which is like Japanese for it really hurts. And they're coming over to me and kind of, they give you some morphine via the drip or whatever, but they're very limited on how much painkiller they can give you because they don't really want to kill you. And I'm shouting Itayo, like it's so painful. I'm in such pain, and so I remember that one of the duty nurses came over and said, she said, "You're scaring the other patients," which I really didn't care about at that time. I was the only one screaming, but not screaming, I mean shouting. But I don't know if the other patients were even conscious, right? and I don't remember. I mean, you don't get any view of the other patient. Like, I can't sit up or anything. You're lying flat on the bed. You know, you see the ceiling and the faces of people that are kind of leaning over you. But yeah, I was like screaming, and she was, yeah, this nurse came over and saying like, you're going to scare the other patients. And then later on, after a few more hours of me like shouting, she said like, you've just had huge surgery. Of course it's going to be quite painful. That didn't really help me much. So first night in intensive care, and it was so boring because I can't sleep, right? Pain was far, far, far too much to sleep. I kind of hoped I would pass out from exhaustion or whatever, but no. It was a good kind of 12 hours or something in absolute agony. This shouldn't put you off. I'm fine. But I remember like just lying there thinking, what on earth can I do to make the time pass quicker? And all I could think of was to try and like in my head watch all the films and TV programs I could remember, like scene by scene. But that was not an effective way. So and you can't think clearly because you're drugged up and in intensive pain. So anyway, at some point they moved me out of intensive care. Now after the liver surgery, I was so the liver surgery was at a hospital in northern Japan, and one of the lovely things about the hospital was that all patients get private rooms. So I had a private room, and it was just wonderful. So private room, and then big issues after surgery. So I'll now kind of go over what it's like after surgery. So at a certain point, like oxygen mask is removed and replaced with that kind of pipe thing that like goes over your ears, and it's got these two jets, so you can like breathe through your nose and get this like cool oxygen coming into you. I should say, like, at least with abdominal surgery, it's actually quite difficult to like breathe in deeply and stuff because it's incredibly painful. So got your oxygen, very, very uncomfortable. Like just the first like week after the major abdominal surgery, very difficult to sleep. You're off in a weird position. The staff will be able to like give you like, they've got various like foam wedges and pillows and rolled up blankets and stuff to try and get your body into a position that's not terrible. They need to move you about a bit in the bed so you don't get bed sores. A lot of surgery, they're going to want to get you to stand up as soon as possible. So with the liver surgery, they wanted me to stand the next day. I don't think I managed it. I did manage it on the day after, I think. That's incredibly painful. And, you know, it's not like they just say, get up. It's like a bunch of staff are going to help lift you up. You're going to still have a bunch of stuff connected to you. Well, particularly in coronavirus time, you might have one of those oxygen meters on your finger. Another finger might be doing your heart. With abdominal surgery, you're likely to have some big pipes coming out of your abdomen that like drain into these bags. So with the liver surgery, I had 3 abdominal drains, and the staff are going to be coming and like looking at the colour of the liquids in the bags, and they're going to be like writing down the volume that's dripped through in the last hour or whatever. You're going to have a urinary catheter to get the urine out of your bladder. Those are like a really crummy bit of technology. Catheter design hasn't really improved in 50 years, I've heard. and they are very painful to have, very painful to get removed. When they remove the catheter, that's a seriously painful process, and they're also very prone to infection. So you've got that, and yeah, after the abdominal surgery, I found it incredibly difficult to sleep. And you're really busy. Like in the beginning time at hospital, you're really, really busy with nurse, at least in Japan, nurses coming to check you every like few minutes later, like every 15 minutes later, every like half an hour later, every like hour, to check your blood pressure, temperature, to note down on these bags, to check your level of oxygen in your blood. Yeah, you're very busy. You're not sitting up reading a book or anything like that. You're not watching Netflix on your tablet or phone. You are exhausted and busy. And with big abdominal surgery or any big surgery, I guess, after a while, you can get out of bed. The staff will try and get you walking very quickly, very early rather, and you get to a point where you can kind of walk around, and there'll be like a lounge area you can go and sit down and stare out the window, and then you're stuck in hospital for a bit. And at the moment, at least in Japan, we can't have visitors in hospital because of the coronavirus. So yeah, you're then stuck in hospital. You are putting up with pretty grim food. With my abdominal surgery, I'm going to be probably on drips for the first few days of no food at all, just nutritional drips, and then a week or week and a bit of liquid food, which in Japan is okayu, so like a very, very watery rice porridge. In Hong Kong, in Cantonese, it's congee. Delicious in the right circumstances in a good Chinese restaurant, not something you want to be eating in other circumstances. And I struggled with a lack of fresh air. So in air-conditioned sealed up in an air-conditioned hospital, and of course frightened about a bunch of stuff that has either happened or is happening or might happen. So with my liver surgery, I had pneumonia, and also my right lung collapsed. So that meant having like regular x-rays in the bed, and that's seriously painful because the x-ray team come in with a portable x-ray machine. First thing they have to do is lift you up in the air to slide a metal sheet under your body so they can do the x-ray. That's really, really, really painful when you've got drains coming out of you, you've got this huge fresh surgical scar, and they're lifting you up in the air to put a metal sheet to x-ray your lungs to see how your pneumonia is going on. So pretty grim, and obviously, yeah, getting to the toilet is difficult. And eventually, the surgeon lets you out. I got out a bit late from my liver surgery because pneumonia, but also blood infection. So I had a drip in my neck, and that got infected. So I had blood infection, which again, it was very scary, like my body shaking and stuff, and yeah, pretty grim stuff. And the surgeon gave me a load of antibiotics and a load of fluids and stuff, and it cleared up really quickly, and I got out of hospital and tried to get back to life at home, which is challenging as well when you might be waking up in the night vomiting or rushing to the toilet, whatever. So hopefully that has been useful for you. it'd be really helpful if you'd subscribe to my channel, but also can you, if you've had surgery, write anything in the comments about your experience. If you haven't had surgery, please, any specific question, and then I can do another video answering all the questions. That'll be great. And thank you as always for the donations to my cancer treatment. Some donations have come in recently, and I may be able to get immunotherapy after the surgery that I'm having next month. After surgery, cancer has a good opportunity to take over your body, and it would be good to get immunotherapy to prevent that happening. Okay, thanks a lot. Please subscribe, and please comment either your own experiences of surgery or any tip or whatever, or any specific question that I can answer. Thanks a lot.